Hello, I'm Dr. Erik Happ. I'm a new doctor here at Carolina Eyecare under USI. I spent most of my career in Pittsburgh, Pennsylvania, where I did my training and spent the first 15 to 20 years of my career. I decided to make a mid to late career move to come down to Charleston, South Carolina and join the group here. My specialization is in oculoplastic surgery. For the most part, that deals with everything around the eye. We don't really operate inside of the eyeball, so we do a lot of lid surgeries. When people have lids that are malpositioned, we can correct those kinds of problems. We remove tumors around the eyelid area. We also do a lot in the aesthetics world, so there's a lot of opportunities to do both eyelid and facial rejuvenation in oculoplastics, and I'm starting to offer some of that now to the Charleston area here. These are interventions that usually can be done in the office. They range from injectable medicines such as fillers and toxins to help reduce wrinkles, to also doing some facial resurfacing type of technologies. These are some of the new technologies that we're going to be promoting here at Carolina Eyecare. Really excited to be part of this practice. After I completed my medical training, I entered the U.S. Navy and I did my internship in general surgery at the National Naval Medical Center in Bethesda, Maryland. After that, I was fortunate enough to stay on active duty for the next 4 years, and I served in the U.S. Navy as a U.S. Naval flight surgeon. This afforded me a lot of great opportunities to travel internationally and treat our sailors both here and abroad. Once I finished my military service, I moved back to my hometown of Pittsburgh, Pennsylvania, and I completed my ophthalmology residency at the University of Pittsburgh. And then I stayed on and I did my fellowship in oculoplastic and orbital surgery at Allegheny General Hospital, also in Pittsburgh, PA. After a short time out in Seattle, Washington, I was given the opportunity to replace my mentor, Jack Kennerdell, and I took that opportunity to move back to Pittsburgh, Pennsylvania. From there, I was in the same department, in the same practice for most of my career. But as my career aged a bit, I started to pivot more towards some outpatient oculoplastics and decided that it was time to move on to a new community and a new surrounding, which landed me here in Charleston, South Carolina with Carolina Eyecare. When I was in the military, I was still trying to find a career path that I wanted to pursue in surgery. One of my mentors was an ophthalmologist, and he introduced me to the subspecialty of oculoplastics. Once I heard about that specialty, I was quite intrigued by it and decided to pursue that for the rest of my career. I really enjoy the aspects of repairing something that might be difficult and puzzling. Therefore, I think sometimes oculoplastics lends itself to a little bit of an art form of being able to put pieces back together where they belong. And for me, this was a draw, and I continue to enjoy that aspect of it today.